are on the Health Watch. We have now our weekly conversation with Dr. Syed Hussain from Trinity Health of New England to talk about all the pressing issues in the world. Good to see you again, Doctor.
Likewise.
Yes, of course we usually wind up talking about COVID. That is winding down now, as is the public health emergency for COVID-19. It's slated to end in May. The question is, what changes, I guess, to people's day-to-day lives can we expect as a result of that?
Yeah, great question. Thank goodness for the end of the public health emergency, which is on the horizon now, finally, after 3 years of going through this. Now, the Centers for Medicare and Medicaid Services will be releasing additional information for providers, for the general public. But what we know so far is that if, for instance, you're a Medicare beneficiary, once the public health emergency expires, Tim, on March 11th, you may expect out-of-pocket costs for, over-the-counter treatment modalities for COVID-19 or home tests, for instance. Those that have been ordered by a healthcare provider will still be covered by insurance, and we should expect similar changes for folks that have private healthcare insurance as well, where some of these costs will be borne by the beneficiaries.
Yeah, so a little more expensive, just something to keep in mind going forward. Really want to get to this next story because it's something we've been reporting on, a growing mental health crisis regarding our youth. There was a survey that found nearly 60% of girls had persistent feelings of sadness and hopelessness. That survey also looked at sexual violence, suicidal thoughts, and substance use, a very sort of whole look at this, and it's a troubling conclusion it came to. Your thoughts?
It is. It's a national tragedy in the making, amplified, Tim, by the isolation and stress induced by the pandemic. So these are really alarming numbers released by the CDC earlier this week. Recall the week before this, they released information that showed suicide in the adolescent age group is now going up after 2 years of decline. So what this survey suggested was 2 out of 3 teenage girls experienced sadness over the last year. 1 out of 5 considered suicide. A similar percentage in those teenagers that identified as LGBTQ, which all goes to show that there's a lot of work we need to do with this age group because they're crying for help.
Absolutely, they are. A lot of people are not taking them seriously. This tends to be the type of problem that can be very maddeningly multifactorial. That's a problem, but usually it starts with interaction, parent to child, peer to peer. What can parents do to try to look for maybe some warning signs?
Yeah, that's key what you just mentioned, Tim. So important warning signs for parents include, have you noticed a change in behavior in your child? Has there been a change in sleeping or eating habits? Are they less interested in activities which previously interested them a lot? Are they more irritable? So all of these things point to a child actually, asking for help, where you would want to intervene. And if you're not the person that they would trust the most, who is that trusted person for your teenager that they can open those lines of communication and dialogue? And then if you do know or know of someone who needs help or has suicidal risk or thoughts, then calling the National Suicide Prevention Hotline or texting at 988. This is a number that was launched, as you may recall, last year, is an important step.
And I'm glad you mentioned that, because unfortunately that's a painful admission some parents have to make, that maybe the parent is not the best person for a child to talk to. Maybe it's a family member, an aunt and uncle, but so long as there is a trusted adult figure, you're at least on the right track. So that's something to keep in mind. Doctor, thank you so much for joining us again. Good to see you again.
Likewise.